kids. You're about to listen to a comedy podcast. That means that none of this is medical advice. If you need medical advice or medical care, please contact your doctor.
Welcome to the Jock Doc podcast featuring Dr. London Smith. He's got the skills to prescribe you pills. Introducing your host, Dr. London Smith.
Hello, and welcome to the Jock Doc podcast, where we discuss fitness and health and how to incorporate our modern understanding of science and medicine into our daily lives, but without it being so boring. I'm your host, drlondonsmith.com. I would like to begin by apologizing to our listeners. We have received some feedback about the inordinate amount of technical terms such as cardiac arrest and cozy blanket. So I will attempt to do better at tailoring my speech to the desires of our listeners as we go on. Here to help with that is our producer, Cameron.
Hello, friends, and hello, Dr. London. Those are two separate categories.
Okay. So Cameron, he works so hard to help this podcast stay relevant that when he first heard the saying, leaves are falling, autumn is calling, and began to see the leaves falling, Cameron immediately went to his phone service provider because whoever Autumn was, their calls were not getting through. And he was absolutely livid. And I do want to clarify, Cameron, leaves are falling, autumn is calling. That's just a saying. It doesn't mean that, when leaves start to fall, you should expect a phone call from someone named Autumn. Do you even know someone named Autumn?
No, I mean, I've been waiting. That's why I don't think autumn is calling at all.
Yeah, well, I would say that's true. Like, it's just sort of a term for the season autumn is coming.
Right. But it does make me feel a little unworthy. It's like a kid who's not visited by Santa Claus. I'm just over here not getting a call from Autumn.
Even though the leaves are, falling.
I mean, not every single one has fallen. Maybe that's the issue.
Once they all fall, you think you'll finally get that call?
And maybe there's a few stragglers every year. And so I kind of...
You never get the call.
Yeah. I don't know. It hurts, though.
Okay. Well, yeah, I'm sorry to hear that, Cameron.
No, you're not. I can see it in your face. You don't care.
Okay. Well, also with us is DJ in the house.
None of this is medical advice.
I can see it in your face. You don't care. You don't care.
I can see it in your face. You don't care.
I can see it in your face. You don't care. You don't care.
Later, Cameron tells me that we can also expect an oncologist by the name of Baron Whvackoff. I think I'm saying that right. So look forward to that. And
I'm not confident I even know how to say that word.
Yeah, it's difficult to say. I hopefully he'll clarify that. And
yeah, bronchologist.
Okay, no,
Bronco.
I was referring to the word to the word Whvackoff, his last name, but the word oncologist is also. I guess that could be difficult to understand if you're not familiar with. So that's like a cancer doctor.
Let me break it down real quick. On. Okay. Opposite of off. Okay. Con. Okay.
No, call. It's COL.
On, con, ol, jod. Okay. Call. Like Autumn's gonna call me in the fall. Oh, gist. oh, I just was conned, right?
I don't think that's right.
Bronchologo.
We can move on from there.
Okay.
But before we move on, I would like to address a bit of listener feedback. Quote, "Is that what they call a uniform in these modern times? Back in my day, I had to spend about 30 minutes getting myself ready for my waitressing job every day. Red lippy, pinstripe apron, LOL. Eduardo's was the best cafe in town. Shame it was demolished. Is how they wrote. Mind you, I never had someone try to dip my fingers in their soup. I think I'd have tipped it over their head. Ha ha. Anyway, give my love to Keith. He does sometimes lose his mind and manhandle young men. XX." End quote.
I love our listeners.
Yeah.
And I do want to say I really relate to this listener because it sounds like it takes them 30 minutes to put on lipstick and an apron. And an apron takes me 30, 40, 50 minutes to attach.
Attach. Well, it's just whenever you put on an apron, it just goes over your head. At least the ones I'm familiar with, it goes one part loops over your head, and the other part you just tie behind you.
Right, but you got to account for all the time spent once it gets stuck on your head, and you're kind of flailing around for a while, tripping, hitting your head on the kitchen counter.
Calling the ambulance.
No,
right.
I've stressed to our listeners, don't do that. It's a scam.
Okay. Well, yeah, and that's... So I think for most people, maybe the loop there is big enough, it's wide enough that they don't get their head stuck like that.
So, I'm not like most people? You're saying I have a huge head?
I was saying that your apron might be smaller. At least that loop at the top.
I'm going to choose to think that you're implying that I have a big brain.
Yeah, I could see that coming.
Yeah.
Okay, well, to respond to our listener. First of all, thank you so much for reaching out to us here at the Jock Doc Podcast. We always appreciate hearing from our listeners. To answer your question, uniforms can vary depending on the job and specialty. Even in medicine, some doctors work more in surgery and prefer to wear scrubs, while others work more in a clinical setting, like outpatient, and they prefer to wear business attire with a white coat. And plenty of doctors are a mix of those preferences. In any case, thank you for your question, and we look forward to hearing from you in the future.
As long as you can see that body, then I think anything is an acceptable uniform. You know what I mean? As long as it fits that shape and you can just kind of see it work. I know I've already covered this on the show.
Okay, so I feel like that's usually scrubs are known for not being so flattering to a person's body type, but I don't know that.
Man, but can you imagine if they were? You're going into surgery, they're wheeling you in. You got this hunky guy over you.
Yeah. Well, usually
this hunky girl.
Well, so
she's jacked as hell. She's like, "Excuse me, sir."
Right. So that's not really what I see as like the purpose of that clothing. It's more to like they wash it frequently.
Feel superior to the people around you, like most uniforms.
It's more to, well, at least the scrubs are for, they'll get stained and whatever. They might get any number of bodily fluids on it, and it's more because it's easier to clean, and it's more of a...
Right, and it wouldn't be as easy to clean if it were tighter on the body, is what you're saying.
Well,
yeah. Didn't think that through, huh, Dr. London? You can continue. I've already won.
All right. Well, let's go ahead and move on. And now for a tale from the GI clinic. We had a patient who was coming in to establish care ahead of his first colonoscopy. He seemed fairly easygoing, but he spoke quickly and his hands were constantly moving, like throughout the conversation. We scheduled his colonoscopy for that week, But
And
I
this
had
is
to
the
warn-
rapper T.I., you said?
Yes.
No, I'm sorry. I should clarify.
Okay.
That's my fault. A GI clinic, so gastrointestinal clinic.
Okay.
Yeah. So
Gotcha.
that's the type of clinic it was. I didn't give this guy's name because that's confidential information.
Right.
Okay, so we scheduled his colonoscopy for that week, but I had to warn the anesthesiologist because with how constantly he was moving throughout the interview, and without any other known medical history, I was fairly certain that he was on some sort of stimulant, like cocaine. And anesthesia and analgesia are common practices, but mixing stimulants and depressants...
Sorry, Dr. London. Now, are you saying that it was for sure not the rapper T.I., or were you saying you just can't tell me if it is or isn't?
Yes.
Okay, I cannot tell you whether it is or is
Okay.
not.
Now, so was this before or after 2008? Live Your Life,
It was after that occasion.
Dead and Gone.
Yeah, it's after that.
Okay, I just wanted to be able to place which T.I. song was in the atmosphere, in the zeitgeist while this was going on. Go ahead.
Okay. All right, and I don't think that would be so applicable, really. But we can. Okay, so, as I said, anesthesia and analgesia are common practices. But if you mix stimulants, like what this patient appeared to be on, and depressants, that's known as speedballing, that can be dangerous. Fortunately, there were no complications, and the colonoscopy was as pleasant as any other I've had the pleasure to have known.
Well, and you would think he'd be a little more careful with that kind of stuff, given that a lot of his peer group, a lot of like other performing rappers and touring rappers, struggle with those kind of addictions. I know it's kind of a hard lifestyle, but
Well, okay, and to clarify once again, I'm not identifying this patient as TI.
okay.
We're not doing that. So what I'm saying is that regardless of what's going on, mixing a stimulant with a depressant isn't a good idea.
Yeah. But I'm just saying, like, I think it's kind of a party lifestyle when you're touring as much as they do, and so it can be difficult and tempting to kind of just take whatever's handed to you. I don't know. I feel for the guy.
Okay, and that's fine. Yeah, having some compassion and empathy is okay, and good even.
Well, and because he knows Rihanna. Live your life. Hey.
Right? Yeah. No, I remember.
Yeah.
We can go and move on from there, though.
Okay.
That was the story. And now for today's medical topic, rheumatic heart disease. Cameron, have you ever had what is commonly known as strep throat?
Let me think. Okay. When I was 1 year old, what did I have?
Okay.
I think I got jaundice at some point. But I don't think I got strep throat. When I was 2 years old, I think maybe I got a cold, but I don't think I got strep throat.
Okay, well,
so at 3 years old,
yeah.
I think I got an inner ear infection, but I don't believe I got strep throat. At 4 years old, I got the plague, but did not get strep throat. At 5 years old, I got gout. So I did have gout at 5.
Okay, well, that doesn't really... So it was just sort of a casual question and not related to gout. Okay. So, well, there's a reason why doctors take strep throat so seriously.
Sorry, my throat's so sore right now. Go ahead.
Okay, so strep throat is caused by a bacteria known as Group A Streptococcus, resulting in streptococcal pharyngitis, or, a sore throat is kind of how it looks. But if you do not diagnose and treat strep, it can progress to rheumatic fever, which is an immunologically mediated systemic process that can cause chronic valvular abnormalities in the heart. And these abnormalities are known as rheumatic heart disease.
Oh, man, can we turn the heat down? I feel like it's hot in here. It's so hot. My throat is killing me right now. God.
Okay.
Go ahead. Sorry.
So the most common abnormality in rheumatic heart disease is mitral stenosis, which is when the valve on the left side of the heart becomes too stiff to open properly. Now, rheumatic heart disease is just one aspect of acute rheumatic fever, which can include...
My heart is stiff as hell.
Okay, I don't think you'd be able to feel it.
Oh, let me try to loosen it up some. Man,
that is a weird stretch you're doing.
I mean, it's just stiff, man.
Okay, because that back bend, like that can't be comfortable for you.
Well, it's not about comfort; it's about talent.
Okay, I thought it was about stretching your heart.
Yeah, and it's also stretching my mind.
Which
and
you
my
see
abilities.
as a talent. Okay. All right. Well, as I was saying, rheumatic heart disease is just one aspect of acute rheumatic fever, which can include rashes, abnormal neurologic movements, arthritis. Okay, you can put your arms down.
Okay.
Also includes nodules under the skin. These are known as the Jones criteria. But all of these problems can be prevented if you get treated for your strep throat before it has a chance to progress and get worse.
Okay.
Okay.
But this isn't a rash, right?
Okay. That is a sizable rash.
Well, I mean, it's kind of gotten...
And you didn't have to take off your pants for that.
no, that's for comfort.
Okay.
This is just for... But what? Is it supposed to be, like, turning that color?
No. No. The yellowish... You might think of going to a doctor about this.
Is it? It's supposed to be as cold as it is. It's freezing.
No, it feels a little bit warm.
No. I mean the rash. Touch it.
No, thank you.
It's ice cold. Like it burns. It's cold, so cold.
Oh, no, I still don't want to, despite the fact that it will burn.
Yeah. You're the doctor. I don't know. I'm sorry. I didn't know. I was just an untreatable patient to you, but that's fine.
Okay. Well, okay. I think that's good for now. Cameron, do we have a sponsor for today?
We do, Dr. London. I'm actually really excited about this.
Okay.
This one is a little, I don't know, not socially conscious, but just kind of conscious of the world, of the environment.
Okay.
You know veal, it's a controversial meal.
Right, because it's a baby animal.
Right. And so a lot of animal rights activists, and even a lot of people who, aren't animal rights activists take issue with it, which I totally understand. I relate to that, and I take issue with it too.
Oh, okay.
And that is one of the reasons I'm so happy about our new sponsor,
Okay.
which is called Proto Foods.
Proto Foods. Okay.
And so instead of eating a baby animal and putting something through that pain, instead you're eating aborted animals. So they're already dead. They've already been flushed out. Just kind of scrambled and just let out.
This doesn't sound good. Okay, because proto meaning like the before.
Yeah, like the original, the origin, the before.
And you're saying that this is like an embryo or a fetus?
Well, yes. And that's what's so great about this is that it's, veal is that's a baby cow. With Proto Foods, you tell them what animal you want the aborted fetus from. It can be any animal.
And it's the unborn child, the unborn offspring of a given animal.
It is the aborted fetus of a chicken, of a cow, of a dog, of a whale.
See, this sounds very. I feel like I might have issues with this as well. Because for one thing, it sounds kind of I don't want to say gross or disgusting, but I mean if it's like placenta?
You probably shouldn't say that our sponsor is gross and disgusting. I would recommend you not saying that too.
Okay, is it? the process, is it like really well refined and cooked? I guess like a hot dog doesn't look like what it's.
Oh yeah,
origins
the
look
abortion
like.
is so quick. They've got it down like to a science.
Aborting the, because then I'm
Oh,
thinking
yeah.
of like the fluid and the material, like the.
Yeah, and all of that is like just sauce for your meal.
Oh, so the bodily fluids from the animal come with it.
Yeah, it's kind of like a bowl.
Okay, this doesn't sound like something I would go for typically, but people do eat things like, I guess, blood pudding.
Yeah.
Okay.
And so if you sign up right now,
Oh.
you can get
Okay.
1,400 hamster fetuses.
Okay, and
Yep.
1,400. So you're expecting people to just plop these in pretty quick.
Oh yeah, it's like I mean I've eaten it as a cereal.
A hamster fetus you've eaten as cereal.
Sure, I wouldn't call it I'm eating hamster fetus. I'd say I'm eating hamster pops or something like that. But yes,
Okay. So it's...
and it tastes just like hamster.
And how do you know that?
How do you think?
So you've eaten hamster outside of this.
Surely that was clearly stated, implied, I guess.
Yeah, no, heavily implied. Okay. I don't want to, but they are a sponsor. So what other animals are available?
Well, Dr. Lennon, that's a good question. That was already answered before when I said every animal.
Okay,
So let's go through them. Bats, dogs, cats.
Are these animals? Are their offspring like forcibly aborted, or is this just miscarriages that happen, like an accidental a spontaneous abortion is a miscarriage?
I think it's very gentle.
By gentle, do you mean like surgically done, or did they give the animals medicine to make it happen?
These are all questions. These are great questions that you could ask the people at Proto Foods.
Okay. And have they gotten any backlash for this?
In this day and age, everything gets backlash. Are you kidding me? With this outrage culture, you can't even eat an aborted, hamster anymore without people getting huffy about it on their high horse.
So you're really into the hamster dish.
Oh yeah, that's kind of my main purchase.
Okay. Well, I guess. Okay, so
Stingrays.
yeah, I guess the one that came to mind is more rare, like elephant,
Oh yeah, elephant,
Zebra.
rhino,
leopard.
yeah, leopards, snow leopards.
Really? And how do they get a hold of? I guess this is another question for.
These are questions that you've got to ask them, Dr. London.
Okay. Well, I guess. What was the name of this company again?
Here, let me have some of this hamster juice.
Okay, you're spilling some, and it is seeping into the carpet, and it is so red and purple.
Oh gosh, God, it's crazy how it tastes just like hamster.
Okay, what was the name of the company again?
Proto Foods.
Okay, well, thank you to Proto Foods. I guess this is closer to being at least remotely medical. Do they have health benefits as far as you're aware?
I mean, I assume they have a full-time staff that would require health benefits. Sure.
Okay, I meant in terms of the food content.
I don't know if it's like Blue Cross Blue Shield or
whatever
their insurers are,
Yeah.
but I'm sure certainly they would have some health benefits.
Okay, I guess we can just. I'm sorry, and it is raw. You're meant to eat it raw.
I mean, that's your choice. You can eat it however you want.
Right. Okay.
My hamster pops, I usually fry them up first.
Right, but you're drinking just hamster juice
Yeah.
as is. Okay. Well, thank you to our sponsor, Proto Foods. We appreciate our sponsors.
Yes, we do.
right, Cameron, you said that we have a guest today?
Yes, we do, Dr. London.
All right. Hello. Nice to meet you, Mr. Baron Whvackoff. Am I saying that right?
Yes, you are correct in that. The name is Baron Whvackoff. Yes.
Okay. Well, it's nice to meet you.
Are you from the East Coast?
Northern California. Yes.
Oh, okay.
So
Okay.
the West Coast.
Oh, yeah. Cameron does get his easts and wests confused.
Very confused, yeah.
Okay, because your accent to me sounds. I don't want to make assumptions, but it sounds more German.
Ich liebe Bananen. You know how it is.
I guess
German
I
or
don't.
Russian? I don't know.
I'm from California.
Or Californian is what I meant.
California.
Yes. A lot of us Californians do sound like this. It's a very common misconception that we sound like surfer people, but we in fact do sound like this very often.
Oh, see, I associate this voice with surfer people. You ever go down to the beach and just kind of every person, they're trying to sell you a hot dog and
Saying Schwarzenheim or whatever.
Yeah.
Yes.
Yeah, it's surfer
I'm
talk.
quite familiar.
Okay. Yeah, well, I'm sorry, I didn't realize that. I visited California, but I guess maybe it's a subtle thing. I didn't pick up on it.
It is a big state. There are multiple communities here, so
okay.
I totally get it.
you can't expect someone as pretentious and wealthy as Dr. London to understand the common man like you and I.
Oh,
He-
of course.
His background, I mean, he was raised in a palace, I think, maybe even a palace on a space shuttle or something. It was something weird like that. And then, I mean, growing up, you owned a train. It just, I don't know. You can't relate. You don't know what it's like to be a Californian or me.
I guess I should clarify something here. So, Cameron, the name London, if you look it up in one of those name-meaning books, one of the names is one of the definitions of it is like fortress on the moon or castle on the moon. So that might be where you're getting this from.
Yeah, and where did that origin come from? A filthy rich person like you. A person who looks at the poverty in this country and says, no, I need more. I need an additional TV. Give me another train. Give me a boat. Anyway,
Yeah,
sorry, I'm rambling
that sounds
now.
like a German thing. The rich looking down at the poor. I wouldn't know anything about that, but that sounds like something Germans would do.
Yeah, that does sound like something Germans would do. And also Dr. London.
Okay, well, we can get back to... Okay, Dr. Whvackoff. So you study oncology, is that right? You're an oncologist?
Well, yes, I work at a call center, so I am an oncologist.
Oh.
Yeah, that's what you told me to
Yes.
get, right, Dr. London?
An oncologist, yes.
Well, so I said...
Because I was on call with him for like 45 minutes earlier today trying to get to change my internet.
Oh, and okay. Because, so an oncologist, that's a term for a doctor who studies and who works in cancer
Yeah.
related things. So if someone, let's say, finds out that they potentially have cancer, they will go to an oncologist to find out about treatment and diagnosis, treatment, and prognosis, genetics a little bit.
Uh-huh. This is very similar. I had called Spectrum, and I said, hey, I want every time I connect to the internet, I want it to go, I do my hair down, paint my nails, run, feeling good as hell.
To
And so
which I responded, that is impossible. What are you doing?
But we bonded. I mean, we talked for a
Yes.
really long time.
Dr. Whvackoff? Yeah, what was your take on that conversation?
Well, it was just like any other Saturday. And yeah, I do work the weekends. I was there sitting at my desk, and this man called me, and he had just this strange subtlety to his voice that excited me, So, when he was talking to me, I honestly, well, I won't go there. But I thought
Okay.
I needed to continue to talk to this man. So I talked to him for a good 3 or 4 hours.
Oh, so
Yeah.
you called back after that
Oh,
40-minute
many
call.
times.
Oh yeah, we've
Many
been
times.
chit-chatting, I mean, for a while now.
So when you said 40 minutes today, this was a continuation from... When did you guys first talk?
Ooh.
I think it was the late 90s.
Yeah, I think so.
Okay, so...
I think. Wait, let me think. Was Bill Clinton impeached yet? Yeah, I was, because I was there for a while.
Yes, yes.
I had to excuse myself from the Senate floor to take one of these calls, so it was during the impeachment. Okay, go ahead.
I'm sorry. And I don't mean to take away from your time, I guess, Mr. Whvackoff, not Doctor. But Cameron, you were a senator? Or you were just working at the Senate?
No. I was just hanging out.
Oh,
There's a hot dog stand there that's like amazing.
okay. Okay, well, in any case, so Dr. Whvackoff, could you tell us about yourself? What, especially, I guess, anything that relates to fitness or health? Have you, I guess, how are you health-wise, maybe?
Well, for the listeners at home, if I were to describe myself, I would say that I am plump. Might be a
Okay.
good descriptor. A large fellow. Someone who cannot fit through a door.
Yeah, when we brought you
Someone
in,
who has...
I didn't know that you were a person at first when
Yes,
you walked into the room.
Yes, a lot of people study me because some people believe that I have my own gravitational pull.
And I do feel some kind of pull, but I thought it was emotional.
That is what some people think, yes. But I think it's just the center of mass making people come in towards me.
Well, and a lot of
Sorry
people,
for... Yeah.
the first time they see you, confuse you with a beanbag chair.
Absolutely. A giant one, yes.
Yeah, like one of those love sack ones you can get at the mall
Yes.
in 2004.
Absolutely.
Okay.
So, with all of that in mind, I would say I'm pretty healthy, I feel pretty good.
Okay. No, that's great. So okay.
I mean, it is normal to feel a constant pain in your chest, right?
Yes.
That's typical.
Oh,
That's
yeah.
just like just daggers in your chest. That's my go-to daily kind of feeling. So I think that's pretty healthy.
Yeah, that boom boom thing on the left side of your chest is supposed to kind of poke you and kind of have a sharp pain continuously.
Right.
And then
So, yeah, I
every
feel
once in a while it
exactly
kind of
like that.
ceases for a while, and then it kicks back on.
Well, have you visited a doctor, Mr. Whvackoff? Like about these chest pains?
No.
Okay. Well,
He said it's not a concern. He said it's normal.
okay. All right. Well, I would
Maybe
just,
you're the abnormal one, Dr. London. Maybe not every person you see and interact with, every common man, is some sort of weirdo, unhealthy freak. Huh?
Okay. Well, I just wanted to, sort of suggest that regular checkups are just good. They'll listen to your heart usually at one of these appointments, and then
You'd love to suggest that, wouldn't you? You would absolutely love to suggest something like that.
Dr. London, if I'm going to be honest,
Yes.
that kind of attitude towards people is exactly why I do not go to see doctors.
Thank you.
Saying,
man.
you should get help. Oh, come in for a checkup. No.
yeah. Okay.
Oh, stop sticking your hand in there.
So that's just a part of sort of what we call preventative medicine. You go in, you see the doctor, they'll listen to your heart, and depending on your age, there might be more invasive things to do. Like what we talked about earlier already was the colonoscopy.
Yeah.
And that's obviously not comfortable, but you are also put under anesthesia for that.
Right,
So-
but things like that aren't accessible to the common man. Of course, TI can afford such a thing.
Okay. Once again, I did not identify who that was.
Right, but you didn't have to.
You know, it was actually T.I. who gave me my last colonoscopy.
Oh,
True
wow.
facts. Yeah.
That sounds strange.
He
Are you
told
sure?
me I have many, what is the English term? Polish? No. Polyps. He said, I have many polyps. And I said, I have never eaten that.
Okay. So a polyp is sort of an outgrowth in your colon, and they can be precancerous or cancerous even.
Yeah, but he just said he's never eaten that.
So how would I have them in my colon?
Yeah.
Okay. Well, and so it's actually your colon itself that would produce it. And actually, if we did have an actual oncologist on the show, they could go into detail on this.
Well, I mean, it sounds like we could maybe get T.I. on the show.
Ooh.
If you know T.I.
Oh, I haven't seen him in a while. Let me try to get in contact with him.
Okay. Well,
I'm actually at the call center right now, so let me try to do that.
oh, you're gonna call him right now?
Yes. What was his number? Okay, I'm calling him now.
Okay.
Give me a moment.
Okay.
Oh. No.
I think he's gonna get him.
No. You stuck your fingers in my. No. This is not T.I. Oh. My bad.
Yeah,
sorry.
I hate it. I hate it when that
Sorry about
happens.
that. I think he was just a man who was very curious. That's the term I'll use.
Well, did he have instruments, or was this kind of a free-for-all?
Oh, this was very much just not even gloves, just back alleyway, just.
Oh,
you know what I mean?
You're saying a literal back alleyway, not like people use that term maybe to call it like a back alley doctor of getting like
No,
an illegal abortion.
It was
or
literally
something.
in a back alley.
Oh, wow.
Yes.
That kind of sounds like T.I. I don't know.
But the thing is, I just asked him, and he said something along the lines of, I've never spoken to you. Who the hell are you? And so that makes me think that I just called a random number. So maybe
just now.
the guy who
Yeah.
put his fingers there gave me a fake number.
Oh, yeah.
So it actually wasn't T.I. So,
well,
unfortunate.
So I have a separate question. I'm sorry, but I believe it is unrelated to that. So, Mr. Whvackoff, are you originally from California?
Yes.
Okay, you've lived. What part of California? Have you lived there all your life, or moved around?
Where's that part of California? Well, I was born in Johannesburg, and then I moved to Sacramento. Then I spent my college years in Berlin, which is a place in Northern California.
Right.
And then I practiced a bit of oncology outside of LA.
wow.
Okay, so to clarify, Berlin. To my knowledge, there might also be a Berlin, California.
Yeah, it's right north of Glendale.
Yes. That is.
Well, Berlin is also a place in Germany. I'm not sure you're aware of that.
Yeah, right north of Glendale in California.
That is.
Okay, I guess.
So what are your favorite Californian foods?
Well, I love beer.
Yeah.
Okay, I feel like it's because California is more known for like Napa Valley wines rather than beer. Right? I mean, not to say that there aren't breweries, but
Well, yeah, if you're a billionaire like yourself, then of course going to these fancy wineries and just drowning in grapes, I'm sure sounds great. But for us commoners, we have PBR.
Yeah, I remember during the cold winter months with all this snow, my friends and I would go to the bars, and there would be these ladies in these green dresses and, these
Wow.
little dancing little shoes. And we would get these big containers of beer.
Oh, as a kid, I wanted to be a Californian clogger.
Oh, they are.
I know
they
exactly
are
what
the
you
best.
mean.
You say it was snowing in California?
Oh yes, it snows all the time.
Did you live in the mountains? Was that 'cause
No.
that
It's those Californian winters.
They are harsh.
See, what I know of California is actually, more temperate weather, kind of easy year round, a lot of areas. I'm sorry, I'm not that familiar with Northern California, I suppose.
Yeah, I mean it gets pretty chilly.
Okay. So, did you have any job before you were on call, or just? I know you said you went to Berlin, and any jobs around there?
For about when was this? This was early 2000s. I worked with a marijuana dispensary.
Smoke weed every day.
Okay, a marijuana dispensary.
Yes, around 2002.
Was it legal at that point? From what I recollect, marijuana wasn't legalized in California for quite a while.
I don't remember
Okay.
if it was
Yeah.
legal. We just kind
Because
of
that,
did
I mean,
it.
that stuff must have been pretty good, right? You know what I'm talking about?
Sure. But
Yeah, but that stuff must have been like pretty strong. You can't even remember it.
oh yes, I do not remember many years of my life. So
Oh.
yeah, I would say I worked that. Then after that, I worked. Let's see, there was that. No, pretty much immediately after that, I was an oncologist. I kind of figured.
So this is really more of a career for you. This is kind of what you were hoping for.
It really is my passion. It really is.
Okay.
Wow.
Yeah, so tell me about the job itself, calling people. You said, what do you call for? Is it to offer, I don't know, assistance or?
Well, so I work at a couple different places. So as of yesterday, I was working at Verizon.
Okay.
So the typical things, you are given a script, and you say things like, "Hello, welcome to Verizon. How can I help you with your problems today?" And stuff like that,
And where's that accent from? Because it sounds like there was a subtle change there for the call portion.
What accent? I'm confused.
So
Yeah, what are you talking about, Dr. London?
okay, maybe it's just me, and I learned to pick up.
Are you making fun of our guest's voice? Dr. London.
No, I was not intending to belittle or to ridicule or mock.
Well, you are very little. You are being little.
I
Okay, well,
would have expected this in Southern California, but to come on this show and have someone make fun of my voice.
It's disgusting. I'm so sorry. You shouldn't have to deal with that.
It's okay.
Can I ask something? Maybe a request, since you're working at Verizon. Are you still working at Verizon, or did that change from yesterday to today?
No, I am still working. Yes.
Okay. I might switch to Verizon Internet if, whenever my Roku connects to the internet, it goes, "I put my head down, paint my nails, tell me how you feel, feeling good as hell." So if you could talk to your CEO and maybe kind of get that into the works, that would be really helpful.
I will not try that. But if you want to call about anything else, literally anything
okay.
else.
See, this has been a point of contention in our conversation since the 90s.
Yeah.
Is that it's mostly me making this same request over and over again at the different places
25
he
years.
At almost every
Yeah.
company
doing
I've
this.
worked at, yes.
Oh, you've been calling him no matter
Yeah.
where he works.
Oh yeah, I mean he worked at Costco for 7 years, and I was still making that
I
request.
totally forgot about that. You're right. Oh, what
man.
a time, Costco. I
Just
remember
some of the stories you used to tell me.
I remember this one time. I was there, you know, doing my thing, and this woman comes up to me. And she has just the most beautiful, you know, gorgeous nose, and
Wow.
I just remember
Okay.
thinking, I really wanted to say to her, "Hey, miss, you're looking real nice." Do you know what I mean?
Yeah. Oh yeah. Maybe honk that nose.
Absolutely.
See, I feel like I heard your accent change again briefly. You know, it's all right. I think it's about time to maybe wrap it up here.
Wow. Just our guest telling a story about Costco makes you so uncomfortable that you have to end the interview.
Well, and it's
I get it.
we've been
Why?
going on-
Just the concept of Costco, knowing that there's commoners there. There's an average Joes, people who maybe look like giant beanbags.
No, it's not that so much. It's just the timing and like it just feels like it's about time to wrap it up. Is all.
I see.
But thank you to Mr. Baron Whvackoff, the on call.
You don't need, our guest did 4 tours in Boston,
This is true. This is very true.
As a caller, you mean?
and you have to respect that.
No, as
I'm
a
just saying.
marijuana dealist.
Okay, well, okay. Let's so we can probably just end it there. Is
No
what
respect. No respect. Yeah. No. Let's go ahead and wrap it up. I'm so sorry about Dr. London's behavior.
It is okay. Well, thank you for having me on the show.
Oh, absolutely.
Thank you for being on. And is there any place the listeners can reach you outside of the show if they wanted to follow you or?
I am typically around some street corners in Sacramento. So
Okay.
if you see just a absolute giant of a man, come up, say hi. I should be around there typically, just street corners.
Great.
All right. Well, thank you for being on the show, Mr. Baron Whvackoff. Thank you to Cameron, as always, our producer.
Absolutely. And no thank you to you, Dr. London. But I will say thank you to the listeners.
Okay. And thank you.
Especially one very special listener, Evan. I don't know if we have a listener named Evan yet, but if we do one day and they listen to this episode, that's gonna blow their mind.
Well, now that you've said all of that, I'm not sure that it'll blow their mind so much.
It would have a second ago, not now.
Okay. Now they'll be like, oh, okay.
Yeah.
Okay. Well, also, thank you to Digital in the House.
Hello, welcome to Verizon. How can I help you with your problems today?
Hello, 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 hello.
Hello.
How can I help you with your problems today?
And my name is drlondonsmith.com. This has been the Jock Doc Podcast.
See ya.
It's getting late. You promised yourself one more podcast before you gave up on all this funny business.
It's getting late, but I want to listen to one more podcast.
In fact, your boss has already been getting on to you about all of the funny business. After all, he says,
Why is my boss at my house?
A funeral home was no place for your pranks. And yet, you keep putting fart machines inside the bodies of the deceased, just so that there can be a few giggles when their loved ones arrive.
Ooh, wow. It's getting so late.
And since we do have the honor of being your last podcast before you give up this funny business, we must advise you that your boss is right, that it is super inappropriate to pull pranks on grieving families.
I guess my boss is right.
Even more inappropriate, though, is when you hold back from sharing with these families your love for the Jock podcast. So please, for their sakes, send them to jockdocpodcast.com and leave a 5-star review in the podcast in which you detail your adventures of putting the fun back in funeral.
I should tell my friends and family about this podcast.
And don't forget to follow us on social media. We are at JockDoc Podcast, and we love to hear from our listeners. So thank you for listening.
I wonder if the Jock podcast has an Instagram, a Twitter account, a Facebook account, even a TikTok.